Well, good afternoon, ladies and gentlemen. My name's Debbie Fleming, and I'm Chief Executive for Poole Hospital. I'm here today with my colleagues to share our plans for developing One NHS in Dorset. Dorset's traditionally been a high-performing health economy, with 4 foundation trusts serving a population of around 850,000 across a mixture of urban and rural communities. We've generally been seen as managing our affairs rather well, and we think we achieve good outcomes for patients and deliver high standards of care. So why on earth do we need to be in the vanguard? Well, to start with, we really do have some very significant health challenges. For example, we already serve the numbers of older people that many across the country are simply planning for. There are pockets of deprivation and stark differences across the patch between our urban and our rural communities, resulting in marked variations in outcomes. We have very significant financial pressures. All 3 acute providers are forecasting deficits this year at around 4% of turnover already, and we will all 3 run out of cash around the end of 16-17. As in many health systems, it's difficult for us to work together. As foundation trusts, we've been brought up to compete, and we've done so for many years. The tariff and current service configuration have created many win-lose situations across Dorset. There are very real differences between the West, which is mainly rural, and the East, which is more urban. And if I'm honest, at times, we actually don't like each other very much. So, the real feature, though, of the Dorset health economy is that in our patch we have a prohibited merger between Poole and Bournemouth hospitals, which now represents a very real barrier to joint working. In 2013, the 2 acutes in the East tried to come together, but we were stopped by the competition authorities on the grounds that it would result in a substantial lessening of competition. This failure has seriously burned our fingers. It's not just that there's now no appetite for mergers. We are actually precluded in law from bringing our services together. So whilst things may look great from the outside, in Dorset we're clear that we're sitting on a time bomb.
I'm Robert Talbot, Medical Director at Poole Hospital, and I'm surprised that nobody has said how bowled over they are to be here today. 12 months ago, the Dorset Clinical Commissioning Group launched a clinical services review, which seeks to address some of the significant health challenges and inequalities in Dorset. This is clinically led and has involved more than 300 doctors, nurses, and allied health professionals from primary care, mental care, community services, secondary care, and social care. Through, first of all, the Big Ask, which was led through the media and through a separate patient and partnership forum, there has been considerable public and patient involvement. And through this, we've designed a blueprint for integrated, seamless, high-quality and sustainable care for the patients and the children of Dorset. The blueprint includes an out-of-hospital integrated community care model. It includes mental care, secondary care, and by putting patients first over the needs of organisations. If we focus now on the secondary care model, this will provide an acute emergency, 24-hour, 7-day-a-week service to the people of Dorset, supported by efficient, high-quality elective services. Delivery of this blueprint will address the considerable workforce and financial problems we sustain. As Debbie described, the acute trusts have barriers about working together. We believe this cannot be delivered by individual organisations working in isolation.
So Robert's just described that we've got a blueprint for Dorset, built up over time. So the Vanguard is perfect timing to be our delivery mechanism. I'm Richard Renaud, I'm the Chief Operating Officer at Bournemouth Hospital. Our plan is based around a multi-specialty joint venture between the acutes for One Dorset NHS. The first order scope of what we're looking at is over £150 million of services, 2,400 staff. So we're ambitious, we want to do this at pace and at scale. Those services include frontline areas like radiology, as well as IT, and they're picked really from areas that the hotspots from that clinical service review that Robert's described, where we've got sustainability issues, but also where we've got some earlier wins as well. The joint venture allows us to keep sovereignty as FTs in the current system, helps us resolve some of those competition issues, but we're very much looking for support in taking this forward. And it's a great platform. We think we can expand this across partners in the community, and the Community Trust supports us, GPs, and of course more acute services, as well as our work with social services. So how can the Vanguard help us? 6 areas: help with competition issues, organisational development for collaborative leadership, patient-centred service redesign, peer learning, practical issues like networks and rotas, the governance, legal, contractual frameworks, and finally with the programme management.
Hello, my name is Patricia Miller. I'm the Chief Executive at Dorset County Hospital. So what will we achieve in the next 12 months? We'll have established our joint venture with an acute care steering board that will manage that venture, pooling services, staff and our financial resources. That will be supported by an integrated healthcare record. We'll have agreed new models of care, sustainable, efficient. They'll also be tackling variation and health inequalities, of which we have considerable numbers. The joint venture will enable us to deliver our SIP programme at scale, which we currently can't do as 3 smaller organisations. We'll also have different contracts in place, longer term contracts, different payment methods in order to support the models that we'll be running. And I think we'll be building confidence and ambition within our health community, taking new services into the joint venture and even different organisations. So why should NHS England choose us? We have got a burning platform, but our clinical service review means that we've got a credible plan, and that plan has got a high chance of success because we've got every stakeholder support, and that support is unequivocal. We've got a unique set of competition issues, as Debbie stated, and that means that we can do some work to understand how we deal with those through the Competition and Markets Authority, because they are real for us. Our rural and urban community model also means that we've got learning that we can spread right across NHS England to different communities with different characteristics, so the model is definitely replicable. And we've got a great history in Dorset of delivering best practice standards, innovation, service improvement, and spreading that learning right across England.
So, we very much hope you support our application and happy to take questions. Thank you.
Thanks very much. So that's developing One NHS in Dorset, and we've already got a couple of questions up in the middle, please.
Come to this.
Yeah, it's me again, Gordon.
Can you wave at me? I can't see you, sorry.
I'm here.
Oh, there you are. Lovely. Thank you.
I'm only small, but the light should be shining off my head.
I can see it.
Innovation in this, that, but what about innovation in patient involvement? That's the thing. I haven't heard anything about innovative patient involvement from any of the trusts or any of the Vanguards today. And it was the same on Wednesday and Thursday at the
Thank you for that
Expo.
question. We did talk about the big ask. I think that's pretty innovative, where the local media, the radio, newspapers, internet, through our website, we had a huge ask of patients and partners for their opinions about the models of care that they wanted to see. I think that was quite good.
It's also fair to say that, over time, across the whole of Dorset, different people have had great models of engaging. It's really important to talk to people, to listen to people, particularly those whose voices aren't always heard. So lots of work directly in conversations, seeking views and actively wanting to find out before we come out with the solutions.
There was a second question in
Can
the
I just
middle.
add something to that,
Yes,
please? The clinical services review that we've all been part of, there has been a patient forum that's underpinned that whole review. So at every point at which we've had a variation of the model, that model has been thoroughly tested with that patient group to make sure that we're on the right direction of travel in terms of meeting our population's needs.
Hello there. I'm going to take a leaf out of that lady's book. So, Trevor Fernandez, patient, East of England. Can I ask you a question about, you mentioned that you are currently a high-performing health economy, but you also say that if you don't do anything, you will run out of cash in 16, 17. So there's a contradiction there.
There is, and I think it's understanding, I think the current configuration of services across Dorset, which was actually set up originally for recognising that each organisation could lead on different things and develop areas of expertise. Over time, through competition and tariff changes, the way that services are currently configured is not sustainable. We're all medium-sized organisations. We're not large enough with the rising standards and the things that we're, you know, the rising standards, the requirement for 24/7 working, all of these things. I think the trusts have all looked ahead and recognised that they needed to do something about that. Certainly within Bournemouth and Poole, they tried and it got stopped. So it's not that people can't manage their money, it's actually the configuration of services, the way that the population's dispersed and some of the history with that.
Okay. Can I be cheeky and ask one more little question?
Very quickly, because we've got somebody else waiting.
Okay, very quickly. You, I believe, are going to have a particularly challenging need to try and engage with your elderly patients. You mentioned about the ASK programme. What mechanism are you going to use to actually reach out to all of these people?
I mean, one thing I want to say is that we don't do that in isolation, and this programme is not in isolation. The Better Together programme in Dorset, which involves the 3 local authorities, all the trusts, all the providers, and obviously patient representatives, that engagement with patients is at the heart of all that we're doing in Dorset as we work together. There are lots of mechanisms which I'm happy to talk to you about, but probably can't do in the time, that if we're not listening to our older people and our children and adults of working age, if we're not listening to everybody, we won't be designing services that they want and need to use. So we are on top of that, but happy to talk about that outside.
Question on table 12, thank you.
Brett McInerney, just volunteering in the local community. I mean, some of the comments in terms of the question around innovation and the response that you gave, quite frankly, I don't see that as innovative, really, to be honest. I think see that as quite standard things that we should be doing in terms of the media and all those other things. Innovative to me is where we're reflecting on people in communities we're not reaching, and then we proactively go out, understanding on the needs of the people before we go out there. That's what I look at as innovative. I don't see using the media, etc., as innovative. I see that as what we should be doing anyway.
Sure.
And you mentioned about inequalities, and I still don't feel nationally or locally sometimes really that we're still reaching those voices that we don't hear at all or not very well. That's what I want to hear coming out innovative. It didn't come out really in that way.
Okay, I'm sorry about that. I think for us what we would say is that working with our local authority partners, who are often extremely good at this and great partners for us in working, we know where the pockets of deprivation are. There traditionally across Dorset been 10 public health action areas, and that work around engaging with the public in those areas of particular need has been long and ongoing work, and we build on that, and we don't start from scratch, and we're always open to new ideas. So thank you for that. There is innovation, but we're all learning, aren't we?
Many thanks. Developing One NHS in Dorset.
Thank you.